Parkinson's and Movement Disorder Alliance is all about providing opportunities for people with Parkinson's disease and other movement disorders, along with their care partners, with opportunities to learn, live life more fully, and connect with the community around them. We do this through a variety of events, and we're going to walk you through the first 6 months of this calendar year. Let's take a look. All of our programs are grounded in a set of beliefs that we hold very seriously. Things like we believe that people are more than their disease. We believe that transparency is a cornerstone of trust. We believe that partnership offers collective success. We believe that sustainability is the essence of organizational health, and that stretching and risk-taking is an imperative. And we believe that risking failure is an essential part of learning and growth. Since our inception, we've been translating our beliefs into meaningful and valuable services for the communities across Arizona. We've based this on a set of data points that we've received from about 600 people that we had conversations with across the state. We asked people, what is it that you need that you're not getting? What is it that's working really well that you don't have any need for, so that we were sure we weren't duplicating things? And then we took that information, put it together with our beliefs and our true philosophy that people are more than their disease, and created a set of programs that are really very innovative and meet people's unmet issues. We've had people ask us about our name, and we chose our name intentionally. We specifically included the word movement disorders in it because we wanted to start a conversation. We wanted to raise awareness about the importance of seeing a movement disorder specialist and the particular scope of work that a movement disorder specialist provides, as well as providing an opportunity to reach undiagnosed or misdiagnosed people. The movement disorders that we're currently working with, primarily it's Parkinson's disease. That's well over 90% of the work that we do. But in addition to that, we do focus on doing some work with Huntington's disease, dystonia, and essential tremor and Tourette's are also components of the work that we do. Because we're not affiliated with any particular medical practice, we partner with movement disorder specialists across the state. In fact, we actually have 13 movement disorder specialists that are our partners and advisors right now. They offer talks for conferences, consultation, education, and just overall support for the work and efforts of PMD Alliance. We are eternally grateful for our movement disorder specialist partners, and we could not do the kind of work we do without them. Providing more than 70 events in a year costs money. We are very grateful for our lead sponsors who have committed support to ensuring that we are able to provide the number of programs and the quality of programming that we have. These sponsors have really helped to ensure that we're able to reach people across the state and capitalize on opportunities as they arise. Let's take a moment and look at our services. Our CPDC, our Certified Parkinson Disease Care Facility Accreditation, is a distinction that we offer to nursing homes, assisted living, retirement centers, and other facilities that have people with Parkinson's who live there. We understand that taking care of a person with Parkinson's requires a unique understanding about the disease, as well as the importance of timely medication, potential interactions, and ways to care for the person with Parkinson's. We've created an accreditation program that allows organizations and facilities to receive ongoing training and increase their competency so that they are better able to take care of the people that they're serving. Now, we could tell you all about our services, but frankly, we think it's better if you can just get a sense of the kind of work we do and the way people interact with the services that we offer.
high blood fever and symptoms. And of those, at least half will go on in just a few years' time to develop.
In the last 6 months, we've provided 8 conferences across the state of Arizona, including a conference for dystonia and essential tremor. We have 6 more planned this fiscal year, and our fundraising has brought us to 64% towards our annual budget needs to provide these services. Our 2-day In Sync conference was held in April and was attended by more than 45 people who run support groups from across Arizona, Utah, Nevada, and New Mexico. The 45 people that attended represent more than 6,000 people with Parkinson's disease. We're pleased to announce that we have achieved 100% of our budget goal for this program for this fiscal year. Another signature program we have is our Get Out program. Get Outs are actually socialization times for people with Parkinson and other movement disorders, as well as their care partners. It's actually founded in some research that shows that socialization is an imperative for good brain health. This is a time for people to get out and enjoy life and live despite the disease. We're 67% towards our goal, our budget goal for the year, to be able to fund these services. Our Move It program has been tested and piloted over the last several months and is ready to launch July 1. This is a subscription-based live exercise program. I'll share more about that in just a little bit. PMD Alliance also has 2 other programs. One is called Inside Scoop. The Inside Scoop is a searchable database that allows people to search for tips and tools and tricks to make life easier when you're dealing with Parkinson's disease. Additionally, we have a YouTube channel, and our YouTube channel has many of the conference presentations that we offer for our Learn, Live, Connect conferences so that they can be watched by anyone regardless of where they live. So let me tell you just a little bit more about 2 of our newer programs. This is a demonstration of our Inside Scoop program. People will go on and they'll be able to register and share tips and tricks so that regardless of where you live and the number of people you're able to interact with Parkinson's disease, you can find solutions and ideas that other people have tried. These are non-medical ideas, and we review them before they're actually posted. As mentioned, we have our online exercise program, Move It Club. The Move It Clubs provide people an opportunity to access Parkinson's-specific exercise programs regardless of where they live. So even if they live in a place where there are no exercise programs for people with Parkinson's, they're able to join a class real time and feel part of a community, part of a class, and get exercise programs that are specifically designed for their disease. We've been asked about how our services are funded. As you look at this graph, you can see that we receive support from a variety of places, including sponsorships, grants, as well as donations, bequests, and memorials. That diversification of revenue mix is part of what helps make us strong. Our key areas that we are seeking to enhance and grow over the next year or so is really our donation, bequest, and memorials. That is the kind of support that allows us to be flexible and create new and innovative programs. As we mentioned earlier, transparency is very important to us. This slide shows you a bit more about how our expenses are laid out and how we utilize the funds and donations for the Parkinson and Movement Disorder Alliance. Specifically, about 82% of all donated funds and funds received go directly to providing the services that we offer. An additional 3% is allocated to helping with marketing and getting the word out about Parkinson and Movement Disorder Alliance, as well as about Parkinson's disease in general, and providing general education and awareness. About 15% of our funds go towards supporting the administrative costs and operational costs of running the organization. Just breaking it down a little bit further. For example, each Get Out costs about $600. That includes all of the marketing, the food costs, the production time, the staff time, and travel time to ensure that we have successful and productive Get Outs. So it's about $600 per Get Out. The sponsorships, which particularly helps us cover the food costs, averages about $300 that we receive for each Get Out. In addition to that, we usually receive about $80 in donations each night, give or take a little bit. So the remaining money that we need to raise to cover our cost for each Get Out is about $220. There are many ways to support the Parkinson and Movement Disorder Alliance. One of the key ways is to become one of our Alliance champions. Our Alliance Champion program is a monthly giving program that supports our ongoing work and ensures sustainability for the organization. You can also look at this chart just to see how a donation of $10, $50, $85 actually impacts the work for Parkinson and Movement Disorder Alliance. For example, a donation of $10 per month or $120 per year will offset the cost of providing a 2-hour training to an assisted living community. Whereas a donation of $50 per month, which would be $600 a year, allows us to provide and purchase the equipment for taping our conferences and posting those to our YouTube channel so that you can see them regardless of where you live. If you're interested in looking at a little more data, we have on our website our quarterly report. This quarterly report is updated, and the one that we currently have on our website includes quarters 1 and 2, so we do a year-to-date report. This is available and has all of the data, numbers, and details that you might want to know about. Again, we are committed to transparency, and we hope that you find that the information that we've shared helps you understand more about what we're doing, the services we're offering, and how the donations and support directly impact the people that we're serving. Thanks so much for taking the time to look through this presentation and for being a part of the Parkinson and Movement Disorder Alliance. We're all in this together.